As the nation mourns the loss of broadcast journalist Michael Sharp, speculations as to the cause of death have been circulating in the public domain, with many pointing fingers at the COVID-19 vaccine. Mr. Sharp, who was inoculated on March 14, was hospitalized shortly after. However, Chief Medical Officer Dr. Jacqueline Bisesa McKenzie is refuting claims that the vaccine is to be blamed for his death. In an interview with the Gleaner Tuesday afternoon, Dr. Bisesa McKenzie said though investigations into the cause of death is still ongoing, Mr. Sharp is believed to have died from complications arising from COVID-19.
So he did present with symptoms and he was admitted to the hospital. My understanding is that a few days he would have received the COVID vaccine on the 14th of March, and shortly after he developed some symptoms which got worse, and he visited his doctor, had a test done, and then with the worsening of his symptoms, he was admitted to hospital.
She says the risk of contracting the respiratory illness after being vaccinated still exists.
We're in community transmission right now, and so there are a lot of persons around us who are COVID positive. And so therefore, our risk of exposure to COVID before we get the vaccine, or even in the period after getting the vaccine, is still there. It's still there. And remember that we do not achieve that robust, long-lasting immunity until we have received 2 doses of the AstraZeneca vaccine and about 2 weeks have passed. So that's when we get that robust immunity. However, even after the first vaccine, there is some immunity, but that also takes time to develop. And so in that immediate period after the first vaccine, persons are vulnerable and they are at risk for severe illness if their comorbid conditions, their age and the presence of, the diabetes, hypertension, heart disease, all of those that we would have mentioned before, if they have those, then they are still at risk for severe illness.
And as it relates to being vaccinated while COVID-19 positive, the Chief Medical Officer says that persons are questioned about displaying symptoms of the respiratory illness before being inoculated. However, there is not a requirement for pre-testing for the virus before vaccination because there is currently no evidence of an increase in poor outcome.
There has been no association really found with persons who, even if they are positive at the time of getting the vaccine, that there is no increased poor outcomes associated with them getting the vaccine. And that is why there is not a requirement for pre-testing before you get the vaccine. However, we do not give the vaccine to persons who are having symptoms or persons who would know that they are COVID positive. We would ask them to wait 14 days to allow for their isolation period, for their symptoms to be all clear before we give them the vaccine.
Mr. Sharp, who was a heart patient, died at the University Hospital of the West Indies Tuesday morning. Stevie and Winter for Frontline News.